Have you or your loved one been diagnosed with COPD? Tune in to this week's episode of Healthline to discover some tips to manage your COPD and prevent exacerbations.
Hi, welcome to Healthline. My name is Brenda.
And my name is Jessica.
Today we'll be discussing some helpful tips on how to manage chronic obstructive pulmonary disease, also known as COPD. COPD is the main cause of morbidity and mortality worldwide. It is predicted to be the third cause of death by the year of 2020. Here's my co-host Jessica to explain exactly what COPD is.
Thanks, Brenda. COPD is a combination of both emphysema and chronic bronchitis. Chronic bronchitis is a chronic inflammation of the bronchi, whereas emphysema is a condition of enlargement of the air sacs, also called your alveoli. Please refer to the following chart that will show you the differences between emphysema and chronic bronchitis.
Even though COPD is a lung disease that never goes away, there are many things a patient can do to help themselves feel better, reduce the number of hospital visits for breathing problems, and to have a healthy, longer life. Here are some tips to help manage your COPD.
My first tip for you, if you have COPD, quit smoking. Smoking is the number one leading cause of COPD, and it will only make it worse if you continue to smoke after being diagnosed. It's also very important to avoid secondhand smoke.
Tip number 2, exercise for 30 minutes a day, at least 5 days a week. If you can't do 30 minutes, you can gradually increase. Start out at 5 and go up as you see fit. Exercising can be a variety of different things. Walking is one of them, or using the elliptical. The main purpose of exercising is to increase your heart rate and increase your breathing. This helps condition your lungs and improve your symptoms of COPD.
Tip number 3, it's important to maintain an adequate and healthy diet. Many with COPD find it hard to eat 3 larger meals due to fatigue and shortness of air. If that's the case for you, try eating 5 small, nutrient-dense meals. It's also important to keep hydrated because this will prevent the mucus from becoming too thick to excrete.
Tip number 4, get vaccinated. You want to make sure to get your flu vaccine every year on time to help prevent an acute exacerbation. You also want to talk to your healthcare provider if you're over the age of 65 about getting your pneumococcal vaccine. It is very important to stay vaccinated to prevent an acute exacerbation.
The 5th step is to use your inhalers as prescribed and with proper technique. There are generally 2 separate inhalers that are prescribed to patients with COPD. One is a short-acting inhaler and the other is a long-acting inhaler. The short-acting inhaler will be used for acute exacerbations, and the long-acting inhaler will generally be used for daily use and will not help any acute exacerbations. Please call your physician to make sure that you properly know how to use your inhalers.
These tips can help manage your COPD and reduce your number of visits to the hospital for respiratory-related complications.
Thank you for tuning in to Healthline. And remember that even though this is a chronic disease, there are many things that you can do to improve the quality of your life and the longevity.